Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, for the past couple of weeks, I've been having this uncomfortable burning sensation when I urinate. It's gotten to the point where it wakes me up several times at night. I tried adjusting the timing of my diuretic medication to help with the frequency, but it hasn't really helped much.
I understand that must be quite uncomfortable for you. How long exactly has this been going on? And have there been any changes or new symptoms since it started?
It started about 2 weeks ago. At first, I thought maybe I was just drinking too much water or it was the diuretics, but even with adjusting those, it didn't improve. Also, I noticed that I've been needing to go more often during the day, not just at night.
All right. And you mentioned you're on a diuretic. Do you recall the name, and are you taking any other medications currently?
Yes, I believe it's furosemide. I'm also on a couple of other medications for my prostate and some others. To be honest, I'm not sure if I might be taking duplicates of something. It's a bit confusing with all the pills.
We'll definitely take a look at your medication list today to clear up any confusion there. Now, about your knee. Can you tell me more about what happened and the pain you're experiencing now?
Sure. About 3 months ago, I fell off a chair while trying to change a light bulb. I landed on my knee and it was bruised but didn't hurt much initially. However, over the past few weeks, I've started feeling sharp pains in that same knee. It's not constant, but when it hits, it's pretty sharp.
Did you notice any swelling or major changes in the knee's appearance since the fall?
No major swelling, just some bruising that went away. The pain is more recent, and it's quite sharp, as I mentioned. It seems a bit worse when I move certain ways.
Okay, that's helpful to know. How has this been affecting your daily activities?
It's disruptive. I'm cautious now about moving too quickly or in certain ways. I've been taking Tylenol when it gets bad, but I'm worried about taking too much.
Thank you for sharing that. We'll address the knee pain as well today. Now, have there been any other new health issues or changes?
No, those are the main things right now. Oh, and I've been using a CPAP machine at night for my sleep apnea. I make sure to take my medications with food too, to avoid an upset stomach.
Good. It's important to take those medications with food. Let's go over the results of the tests and examinations we've done today. Your blood pressure is stable at 135/85 milliemergs, which is good. Your heart rate and other vitals are also within normal ranges.
That's a relief to hear.
Yes, and your lab tests, including your blood count and metabolic panel, are generally within normal limits, which is reassuring. However, your fasting glucose level is a bit elevated at 126 mg/L, and your HbA1c is 6.5%, which puts you at the high end of the prediabetes range.
I was worried about that. I'll need to watch my diet more closely, I suppose.
It would be beneficial. As for your urinalysis, it shows trace leukocyte esterase but no nitrites or significant protein or blood, which might suggest a mild urinary tract infection or irritation. Given your symptoms, I will prescribe an antibiotic to help clear this up.
Thank you, doctor. And the knee?
The X-ray shows early signs of osteoarthritis, but no fractures, which aligns with the type of pain you described. For now, continue with Tylenol as needed, and we should consider physical therapy to help manage and possibly alleviate the pain.
Sounds like a plan. What about the medications?
I'll review your current prescriptions one by one to ensure there are no duplicates and adjust as needed to better manage your conditions without unnecessary overlap.
I appreciate that. It's been a bit confusing managing all these medications.
Absolutely. It's important we keep that sorted for you. Lastly, I want to see you back here in 6 months for a follow-up, but please call or visit if your symptoms worsen or if you have any concerns before then.
Will do. Thank you for all the help today, doctor.
You're welcome. Take care of yourself, and I'll see you soon.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've been experiencing some concerning symptoms lately, particularly at night. My cough seems to be getting worse, and it's been affecting my sleep quite a bit.
Good morning. I'm sorry to hear that. Can you tell me more about your cough? How long has it been going on?
It's been a few months now. It gets worse at night, and sometimes I feel like I can't catch my breath. It's a dry cough, mostly, but sometimes I do get a bit of a runny nose that seems to trigger it.
Does anything seem to improve the cough, or are there any specific triggers you've noticed besides the runny nose?
Not really, though I've noticed it becomes more manageable during the day. I've been using loratadine, as you recommended, thinking it might be allergies, but it hasn't made much of a difference at night.
I see. And how about your breathing? You mentioned shortness of breath when climbing stairs.
Yes, that's been ongoing for several months too. I don't feel like it's gotten dramatically worse, but it hasn't improved either. It's especially noticeable when I'm going up the stairs or trying to hurry.
All right, thank you for sharing that. Have you had any other symptoms? Fatigue, dizziness, anything like that?
Occasionally, I feel unusually tired, but I suppose that's not unexpected at my age. Also, there were a few times I felt dizzy when I bent over, but that's less frequent now. My main concern today, really, is the cough and the breathlessness because they're impacting my daily activities.
Understood. And how has your heart been feeling? Any chest pain or palpitations?
No, nothing like that recently. Since my bypass surgery, I've been careful to monitor any heart-related symptoms, and thankfully, there haven't been any new concerns there.
That's good to hear. Now I'd like to revisit your medical history briefly. You had a triple bypass surgery back in 2010, correct?
Yes, that's correct. I had triple vessel disease and the surgery was quite successful. No fainting spells or anything severe since then.
Excellent. And there's also a history of prostate health concerns, isn't there?
Yes, diagnosed with an enlarged prostate quite some time ago, around 1999. My PSA levels have been high, which worries me a bit, but I've been on finasteride and terazosin, which seem to help.
Okay, we'll keep monitoring that closely. Now, regarding your kidneys and the issue of your blood counts.
My kidney function has been stable from what the last tests showed. I know my creatinine levels are a bit high, but they've been steady. And yes, my blood counts have had their ups and downs, which is why we do the regular blood work.
That's right. Let's ensure we keep a close watch on those. You also mentioned pre-diabetes in your recent blood work.
That's correct. The last few readings have shown my blood sugar levels hovering between 110 to 125 milligrams. I know I need to watch my diet more closely.
Yes, managing your diet will be crucial. We'll get you back to the nutrition clinic for that. Now, let's discuss your current medication list to ensure everything is up to date.
I'm also currently on aspirin, Metamucil, fish oil, Lasix, lisinopril, metoprolol, simvastatin, and potassium supplements.
Thank you for confirming that. Given your symptoms and history, let's plan our next steps. First, we'll continue with loratadine and monitor if there's any improvement. I also suggest we adjust the dose of lisinopril slightly and see if that helps with your symptoms. Furthermore, we need to ensure your cardiac function is well managed, so a follow-up in the cardiology clinic is crucial. We'll also repeat your blood work to monitor your kidney function and blood counts closely.
That sounds good. I appreciate your thoroughness, doctor.
Of course. It's important we stay proactive about your health. I'll arrange all the appointments and tests, and we'll meet again to review everything. Take care until then, and please reach out if your symptoms worsen or if you have any concerns.
Will do. Thanks again, doctor. See you soon.
You're welcome. See you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've reviewed your recent x-rays, and given the persistent pain you're experiencing in your foot, I believe it's best to refer you to a specialist.
Do you think it's something serious?
It could be a variety of issues, like a stress fracture or a ligament problem, but Dr. Lewis, a podiatrist, will be able to provide a more specific diagnosis.
How soon should I see her?
I'll make the referral right away. It's important to address this soon to avoid any complications. Dr. Lewis's office will contact you to schedule an appointment.
Thank you, doctor. I appreciate your help in getting this resolved.
You're welcome. It's important to take care of this early. I'll send over your files today, and if you have any questions after your visit, please don't hesitate to call us.
Now look at question 26.
Good afternoon, everyone. As you know, we're expecting a major winter storm this weekend, and I want to discuss our safety protocols.
Yes, thank you. First, please ensure that all emergency generators are fully functional. We can't afford power issues.
Absolutely. Additionally, all staff scheduled for the weekend need to confirm their availability to stay overnight if travel becomes unsafe.
Let's also make sure our communication lines are open and functional. We need to be able to reach everyone without delays.
I'll coordinate with the transport team to ensure that patient transfers are handled before the storm intensifies. Safety of our patients and staff is our top priority.
Thank you for your thoroughness. Let's all stay alert and prepared to respond as the situation develops.
Now look at question 27.
Dr. Bennett, regarding Mr. Thompson in room 204, I've noticed he's been increasingly agitated in the evenings. Should we consider adjusting his medication?
Yes, I've read your notes. His current regimen may be causing some sleep disturbances. Let's try lowering the dose of his stimulants.
Do you think non-pharmacological approaches might help? Perhaps more daytime activities or therapy?
Good point. Let's incorporate more structured activities during the day and monitor his response. We want to keep his use of medications as minimal as possible.
I'll update the care plan and coordinate with the therapy team. I'll also keep a close eye on his evening mood and behavior.
Excellent. Keep me updated. Let's review his progress in a week and decide if further adjustments are needed.
Now look at question 28.
Welcome, everyone. Today we're focusing on sleep hygiene, which is crucial for both physical and mental health.
Exactly. Let's start by discussing the importance of a regular sleep schedule. Going to bed and waking up at the same time every day helps regulate your body's clock.
Reducing blue light exposure in the evening is also key. Devices like smartphones and tablets can interfere with melatonin production.
And let's not forget the bedroom environment. Keeping it cool, quiet, and dark can significantly improve sleep quality.
Lastly, avoiding large meals, caffeine, and alcohol before bedtime is beneficial. These can disrupt sleep and affect sleep quality.
Thank you for those insights. If anyone has questions or needs personalized advice, feel free to stay after the presentation.
Now look at question 29.
Now that your sutures are in place, let's go over how to care for them at home to prevent infection and ensure proper healing.
Okay, what should I do first?
Keep the area clean and dry. You can gently cleanse the area with soap and water, but do not soak or scrub the sutures.
Should I apply any ointment? or just leave it?
You can apply a thin layer of antibiotic ointment if I prescribe it, and then cover it with a clean bandage to protect it from irritation.
How often should I change the bandage?
Change it daily or whenever it becomes wet or dirty. If you notice increased redness, swelling, or pus, contact me immediately.
Got it. And when will these be removed?
They're typically removed in about 10 to 14 days, depending on how well the area heals. We'll schedule a follow-up to remove them safely.
Now look at question 30.
Thank you for joining today's session on the importance of seasonal vaccines. Let's discuss why these vaccines are vital.
Seasonal vaccines, like the flu shot, play a crucial role in protecting us from prevalent viruses, especially in vulnerable populations.
Exactly. Each year, the vaccine is updated to combat the most current strains of the virus, making annual vaccination essential.
Getting vaccinated not only reduces your risk of getting sick, but also protects those around you by reducing the spread of the virus.
We encourage everyone to get vaccinated early in the season. It's an important step in preventive healthcare.
If you have any questions about which vaccines are right for you, please consult your healthcare provider. Stay healthy and protected.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, I'm thrilled to have Dr. Ed Bussett with us to discuss his work on integrated healthcare delivery systems. Dr. Bussett, could you start by telling us a bit about your background?
Thank you. My work primarily focuses on risk adjustment studies of hospital outcomes and, more recently, predictive analytics to support clinicians in real-time decision-making.
Many of our listeners are familiar with early warning scores and rapid response teams. Could you discuss some limitations of these tools and their impact on important hospital outcomes like mortality, ICU admission, and length of stay?
Absolutely. While these tools are fundamental in clinical settings, they require manual data abstraction and calculation, which is burdensome for healthcare providers. Additionally, the statistical performance of these manual tools often falls short, and they aren't integrated well into existing workflows, limiting their impact on hospital outcomes.
That's quite insightful. Can you explain the concept of machine learning and its application in clinical medicine for our audience?
Machine learning allows computers to process large amounts of data efficiently to identify strong predictive signals. This technology uses advanced algorithms to enhance traditional statistical methods, helping to manage the vast data generated in modern healthcare settings, from electronic health records to wearable device data.
Now, let's talk about the specific study you conducted. Dr. Bussett, could you tell us about the background of your study and how it came about?
Our study originated from the observation that patients who deteriorated on wards had poorer outcomes than those directly admitted to ICUs. With the advent of comprehensive electronic medical records, we saw an opportunity to use this rich data to develop more accurate predictive models, supported by the Gordon and Betty Moore Foundation.
What were the components of the automated predictive model used in your study?
The model incorporated demographics, laboratory results, vital signs, and longitudinal comorbidity data. We also included interaction terms like the shock index to enhance the model's accuracy.
What were the significant findings from your study?
We observed that the intervention decreased mortality rates, reduced ICU admissions, and shortened hospital stays. Essentially, our predictive model helped to identify at-risk patients earlier, allowing for timely and targeted interventions.
Implementing such a complex model in a clinical setting must have challenges. Dr. Bussett, can you discuss these?
Implementing any new workflow in healthcare is challenging. The primary barrier is gaining the trust of clinicians who must rely on the model's predictions. Building this trust requires demonstrating the model's accuracy and effectiveness in real-world settings.
As we wrap up, can you reflect on the future barriers and opportunities for integrating such systems into routine clinical care?
The biggest challenge remains clinician adoption. Ensuring that these models are intuitive and integrate seamlessly into clinical workflows will be critical for widespread acceptance and success.
Thank you, Dr. Bussett, for this enlightening discussion. It's clear that predictive models hold significant promise for transforming healthcare delivery and improving patient outcomes.
Thank you for having me. It's exciting to share our work and explore how these technologies can continue to evolve and benefit patients globally.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we're exploring the intricate and ever-evolving field of genomics and its impact on personalized medicine. Specifically, we're focusing on a recent Harvard study that examines the role of genomic sequencing in predicting and preventing cardiovascular diseases. This is a particularly pertinent topic as cardiovascular disease remains the leading cause of death globally. Now let's consider a case study that vividly illustrates the potential of genomic medicine in clinical settings. We're looking at the case of a 54-year-old male patient. Let's call him John. John has a family history of premature coronary artery disease. His father had a myocardial infarction at 49, and his older brother underwent coronary artery bypass grafting at 53. Despite being asymptomatic, John was understandably concerned about his cardiac health. His primary care physician recommended comprehensive genomic sequencing as part of a pilot study described in the Harvard research. This decision was pivotal, as the results of the sequencing revealed that John had a genetic variant known to significantly increase the risk of coronary artery disease. Equipped with this information, John's healthcare team took a proactive approach. They intensified his management plan, focusing on aggressive lifestyle modifications and pharmacotherapy. This included starting statin therapy, despite John's relatively normal cholesterol levels, a decision informed by his genetic risk profile. Now let's discuss the broader implications of this approach. The integration of genomic data into the clinical care of cardiovascular patients represents a significant shift towards more personalized medicine. The Harvard study highlights several key benefits of this approach. First, it allows for earlier identification of individuals at high risk, as in John's case. This can potentially lead to early interventions that may delay or even prevent the onset of disease. Secondly, the study discusses the potential for more tailored therapies. In traditional models, treatments are often based on population averages. However, with genomic information, treatments can be more closely tailored to the individual's genetic makeup, potentially increasing efficacy and reducing side effects. However, the study also brings to light several challenges. One major issue is the interpretation of genetic data, which can be complex and requires a high level of expertise. There is also the concern of genetic privacy and the ethical implications of genetic testing, which must be navigated carefully to respect patient confidentiality and autonomy. Furthermore, there's an ongoing debate about the cost-effectiveness of genomic sequencing. While the costs of genetic testing have decreased over the years, the overall cost-effectiveness in terms of improved clinical outcomes is still under study. The Harvard research calls for more comprehensive studies to evaluate long-term outcomes and cost implications. The integration of genomics into cardiovascular disease management offers exciting possibilities for enhancing patient care through personalized medicine. Yet, it also presents significant challenges that need to be addressed through careful clinical and ethical considerations. As we move forward, it will be crucial to balance these opportunities and challenges to optimize the benefits of genomic medicine for patients like John.